the takeaways that I think about for gut health is a lot of the things that we would many of us get used to calling normal. Like I remember a period of my life where I had acid reflux every day, every single day, all day long. And I just thought that was me and that's who I was. And I was going to be somebody with acid reflux. And obviously like, I mean, I was even diagnosed at I was diagnosed at age 8 with acid reflux disease. Yeah. I had chest pains in class. I remember sitting in 3rd grade and having chest pains. And obviously my mom took me to the doctor and they did a full heart workup. There was nothing wrong with my heart. But they did the barium test and I had severe acid reflux disease, as a child. And that went all the way through adulthood. And it was so bad in the Navy that they actually did an upper endoscopy to check for the start of esophageal cancer. Cause they were
Yeah.
that bad. I mean, I ate Tums all day long. I was on Zantac 150s, the proton pump inhibitors, all of it. And my reflux just was, again, normal for me. Sometimes it was terrible. Most of the time it was just there. I ended up resolving it through some dietary changes that I never, this baby has lost her dang mind today. I never thought it would go away, but it did. Hold on, I'm going to give this baby a boob. I never thought it would go away, but it did as a result of an elimination diet. And learning sort of a few things that my body did not do well with. And then also removing, I think at the same time that I did the elimination diet, I also removed a couple key things that I think were problematic for me, which were a lot of artificial sweeteners, a lot of processed foods that were in the form of diet sodas that I drank all day long, all the time. It wasn't 1 or 2 a day. It was 7 or 8. And anyways, when I removed that, my reflux went away. So the whole point of that whole story is I had something wrong. And since that time period, my immune system's better. My weight management's better. A lot of the things that I think were super duper hard are less hard. And I can't say for sure that removing my reflux is, the direct relation, but it was definitely related in some way.
It's huge. Yeah. And that's such a fundamental part of our digestion, right? It's north to south thing. So we talked about, really step one is being in that mindset, ready to eat. So calming down and getting, in that rest and digest state, but then chewing our food and then the stomach. If something's not going right at the stomach, that's so at the top of the, food chain, but that's a really fundamental step. So if our stomach's not working properly, how on earth is the small intestine and the large intestine, and then how are we going to go to the bathroom every day like a normal person? All that stuff after that is just it doesn't have a chance to work correctly.
How quickly does gut health change under stress? I think that was our first topic that we hit.
I think it depends on the person, but it can be pretty acute. Some people for the functional medicine approach, she does a long format. It's tying people's diagnoses to specific stressful events, and it usually correlates pretty well. As far as how fast it can start to affect, it might take a little bit because I think your body's pretty good at trying to compensate. But yeah, this could this type of stressor for society could be the start of a chronic condition that people start to discover and get diagnosed a year from now or something like that. So.
But literally, the phrase, it made me poop my pants is probably
yeah.
Yeah. So it could be instant.
It could be instant.
Stressed and hurried and go. And
right.
Other cultures do much better with chill mode to eat.
Right, G?
Right, G.
Yeah.
Chill.
Yeah. Right. Yeah. So I feel you. Yeah, absolutely. Yeah. It's hard too. If you get time crunched, but that's your 30 minutes to eat. It's hard to kind of navigate that sometimes, but just being aware of that. So maybe half the time you're a little bit more aware than what you were before. That's still better.
Yeah. Yeah. That's a good question. And I think that that's a really good, tangible reminder for right now. If you're feeling stressed, give yourself a minute to come down, or 5 minutes or 10 minutes, and bring yourself down a little bit and then eat.
Yeah.
a lot of people think that like not pooping every day is normal, being bloated all the time is normal, that they, you know, have stomach pains and that's normal. It happens after X, Y, and Z, or like all of these things are, we've sort of accepted, and they shouldn't be accepted because there's something not quite right there. What can lead to gas and bloat in the evening?
Could be overeating, could be not enough digestive juices. So if we aren't calm, if we're not secreting enough stomach acid, or if we don't have enough digestive enzymes to produce or secrete from the pancreas, then that will mean that our food's just sitting there, not digesting properly. Then bacteria will start to ferment it and cause that gas. So a really easy thing you can do is, you know, trying to be calm, trying to be ready to eat, and then also just finding some local or digestive enzymes at your local grocery store to help break down your food a little faster.
You're going to set your body up for success.
Absolutely. Just takes practice too. I mean, I'm not always great at it, especially with like all the COVID-19 stuff. We're trying to stay informed all the time. But also like, yeah, don't listen to the news while you're eating. So you're like getting stressed out, trying to eat or something like that. But yeah, just taking a minute to like maybe look outside and just try to calm down.
Yeah, I've noticed it's a weird thing. I don't think it's gut health related, but I've just definitely noticed not so much stress eating, but I found myself like overfilling myself the past couple of days very strangely. I'm like, why did I eat an extra whole serving? I wasn't even hungry, but I like overate multiple times this week.
Yes. And that's the trend I've been seeing like with my gym. And I actually like have a Zoom call scheduled for Saturday night. So I was like, can we just talk about this? Cause everybody's like, I'm eating everything, like with the quarantine 15 memes going around, like everybody just eating too much. I think it is, we get in that stress state and you just start shoveling and then you realize like, I'm way over full. Yeah. You're right. I was,
breakfast the other day and I'm like, why did I do that? I'm so full. But it was like a strong urge to do it.
Yeah.
Just made me think of something. One of the questions had to do with period bloat and GI like upset several days after that. Or I think she said she gets her period.
I have the questions.
Yeah, do me a favor, pull that up, because there was definitely a link with her cycle and bloating and GI upset.
That's an interesting one. I'm not super well versed on that, but I think, was it Jolene Brighton, Dr. Jolene Brighton? She's a naturopath. She's a guru when it comes to all things like women's health and hormones. And I believe that's due to the increase in progesterone. And that increases like muscle contraction. So like uterus is contracting, like you're bleeding, but then also that affects your GI system. So that's often why you can have, I think, like loose stools during that time as well. That's what at least comes to mind first, but I'm definitely not.
Yes, her question was like, how do hormones play into gut health? My monthly bloat week is always followed by constipation. And I actually know exactly who wrote this question now that I'm reading it. It's really interesting because we started seeing like a weight increase, almost cyclical. And then we ended up tracking it to her cycle. And it was like a significant bloat week that happens. I have 2 people, you know, that are similar that notice something like that that's related to their hormone cycle.
Yeah, I don't know exactly what, but I mean, I think that's pretty common against all my clients as well. They're like, oh, the scale went up. I was like, yeah, it's around your cycle.
So what was that naturopath's name?
Dr. Jolene Brighton. I think she used to be local to Portland. I don't know if she still lives in that area, but she has a book called Beyond the Pill. It's about coming off of conventional birth control. And then also all of her website, all of her resources are just awesome. She's a guru when it comes to that kind of stuff. But yeah, super